Hello parents, this is Dr.Deepthi. We are from Happy Kids Special Needs Center. We cater to different kids with autism, virtual autism, speech delays, ADHDs, dyslexias and other neurobehavioral problems. And one of the common presentation we get is echolalia in children. So most of the parents might have heard this word, that is the child is just echoing the words or the phrases they are listening without really understanding the meaning. Sometimes they might be understanding the meaning also, but they are just reflexly repeating the words or phrases. So this is called echolalia. So is it normal? Is it normal, or only is it related to autism? If echolalia is there, is it equivalent to autism? So these kind of questions are very common. So let me address them quickly. Echolalia, most of you might be knowing the meaning, like I said, but there are two forms of echolalia, which is immediate echolalia and delayed echolalia. Immediate echolalia is self-explanatory. The moment you say a phrase, he is repeating the phrase. If you say what is this, he is saying what is this. So this is immediate echolalia. Whereas delayed echolalia is, he is hearing you say something and he is saying that or repeating that sometime later, maybe in context or out of context, but he is repeating sometime later. For example, you said let's go wear shoes. He remembers this phrase and he is using it sometime later. Wherever you are going, he is saying let's go wear shoes. So this kind of thing is a delayed echolalia. And something intermediate is like he is repeating the question and then he is giving the correct answer also, but always he repeats the question and then he gives the answer. That is some intermediate form. And echolalia can be broadly divided into, which is more important to us, is interactive echolalia and non-interactive echolalia. Interactive echolalia is when the child is looking at you, he understood your question kind of, he is having fair eye contact with you with a good expression on his face, he wants to say something but he is just repeating the question. This is interactive because he has an intention to communicate. It is just that the right sentences he is unable to make on his own. So he is just repeating the question. Whereas non-interactive echolalia is, he is hearing some phrases here and he is uttering them when he is alone or while he is playing, or he has heard something from the cartoons or on the net and then he is saying it aloud repeatedly while playing. This is completely a non-interactive echolalia. So now if there is echolalia, should we be very skeptical about it, or should we take it as a very bad sign or negative sign? No, not at all. 80 to 90% of echolalia has an intention to communicate. That means the child, three things you can get if a child is echolalic. First thing, he is hearing you, only then he is repeating. He is processing what you are saying. He is trying to understand the meaning of this, he is trying to memorize it and then he is trying to repeat it, and there is a interest to communicate. Otherwise why would he repeat your phrase? He would just ignore and walk off. You ask something and he has an interest to answer, only then he is repeating the phrase. So three good pointers are there. So don't panic if there is an echolalia. Let's see how we can deal with it. So the first we need to know what echolalia signifies. I mean exactly what is the child trying to do in his brain while he is echoing. So first thing is like it could be simple stim. In a typical autistic child, they are over saying the same thing again and again and again as a self-stimulatory behavior, which is very commonly seen, like the rhymes they see on the TV or some of the phrases from the favorite cartoon channels. They are overtly repeating. This is kind of stim, a self-stimulatory behavior. But most of the time echolalia is not for self-stimulation. So what else it could be? It could be that he is trying to memorize what you said. See, just take an example. When you were a child, how did you learn in the school? The teacher will say once and you all repeat it 4 or 5 times, right? If the teacher says something like A for apple, A-P-P-L-E, apple, then the all the children will be repeating 3 to 4 times the same thing aloud. So this saying it aloud actually helps in memorizing more quickly. So the child is also doing the same thing. He is trying to memorize what you are saying. Second thing, he is taking time to process it and understand the meaning of it. So what do you do when somebody says something and you didn't figure out exactly fully what is the meaning, or maybe you are seeing a TV channel or something and they said something, some dialogue, and you fully didn't figure out. What do? You repeat the dialogue either aloud or in your mind and keep thinking, what could this be, what could this be. So exactly they are also doing the same thing. This you can see when you are going to some land where there is a foreign language. They say something and you are like exactly Tanni Venuma if they ask somebody in Tamil, which means do you want water. So you have heard it for the first time or second time, you exactly didn't catch the phrase, then you keep on repeating to yourself, Tanni Venum, okay, this is to ask for water, let me remember it. So this is a way you are processing it to find the meaning. And then the third could be that it is an attempt to show that you are turn taking in the conversation. For example, just a example to understand this better, in your exam if they give a question and you don't know the answer, what do you do as a child? What you did? You would write the same question again, or you would just change it a little bit and write the question again. There is no answer, but you just repeat the question. What was your interest in doing that? You could have left it blank also, but you thought, if I attempt it, maybe I will get a grace mark, because the examiner will think, at least she attempted, at least she thought of impressing me. So the same way the child is also trying to impress you that he is interested in the conversation, but he doesn't know the right words as of now. So this is a turn taking move. And fourth thing is, he is buying time. This is very, very important. So in an interview, if they ask you a difficult question, or even in your viva in the exam, if they ask you a difficult question and you don't know the answer, what do? You try to repeat the question. If they say, what is the cube root of this number? You will be like, cube root of this number is cube root, and then you will come up with some answer. So you are buying time while you are repeating the question. So the same thing the child is doing. He is searching, he is scanning his brain for the answer, he is not getting it. So he is just buying time by repeating the question. At least give him a mark for that. And last one is scripting, which means in a different context, he wants to talk but he doesn't know the exact word. So whatever he has heard earlier in similar conversation, he will pick. For example, you said let's go wear shoes when you went to the park. So he remembers that and he is using that phrase whenever he wants to ask you to take him out. Let's go wear shoes. Then he understands that, okay, mother will relate to the earlier context. Or maybe he has seen a happy birthday party and everybody singing happy birthday. So whatever event is there, he would say happy birthday. It could be anything. It could be even a happy new year, or it could be happy pongal, but he'll say happy birthday because it is a form of wishing for him. He doesn't exactly know what to say. So these are the different kinds of reasons why a child is echolalic. Now that we have understood why they become echolalic, now what to do? That's the next step. So first thing is relax. This echolalia is a good sign which shows that he has interest to communicate, he is hearing you, he is searching for the answers. So you relax and don't put pressure on him. That is very important. Second, never say don't say like this, because it is coming like an involuntary response to him. So instead of saying that, then what you should say? You should be modeling the conversation. And one more thing before modeling is important is that we should limit the questions, because the more questions you ask, the more questions you will get as a response. What is this? He'll say what is this? Which color is this? Which color is this? 1 plus 1 is what? He'll say 1 plus 1 is what? So most of the time in kids with speech delay, either we are only questioning them, or we are ordering or requesting them. These are the only two things. We are not really conversing with them, right? Either we are saying do this, or we are saying what is this. So either way he is going to remain more echolalic. So then if you say, okay, if not asking questions, what should I do? Should I never ask questions? We are not saying never ask questions, but it should be in the ratio of 80-20. I mean 5 times you are talking to the child, 4 times it should be general talk, 1 time it should be a question. So let's see with an example. So a child comes to your therapy session, or you are a mother and you are sitting with the child and doing something. You can say hello, and he says hello. Open the book. He's saying open the book. oh, there is a picture of a hippopotamus. He is also saying there is a picture of hippopotamus. It's so big and scary. He is also saying it's so big and scary. Where is his tail? Then he is like, where is his tail? Here. And you can show here. So this is how you can model a conversation with a minimal questioning and more of a talk. And other 3-4 tips to lessen or mitigate this echolalia is that when you are asking a question, you stress on the answer right away. Like for example, you are teaching him, what is daddy's name? Raju, like that. So that Raju has to be really emphasized so that he is taking that word. Or what is mommy's name? Sujata. Then he is taking Sujata word from that. The second tip is that when you are asking something, some question, give him a visual cue so that his attention is immediately shifted to the answer. For example, there is a book in front of you with all animals and you are asking something about the animal. Which animal lives in the den? Tiger. So he has already seen the tiger, so he will attempt to say it. Or you could also do like this, which animal lives in the den? So by that sound he is relating it to a tiger. This is also another way. So these cues are diverting his attention immediately towards the answer. Or you could also say like this, how does an aeroplane fly? In the sky. So pattern or rhythm will divert him from the question towards the answer. And last point is that you have to expand what he says. Because he is an echolalic child, he will just repeat whatever you say. Now you should not stop there. For example, we will continue from the last question. So, where is the aeroplane flying? Sky. Then he says, sky. It is flying so high. He is also saying, flying so high. Then you can say, flying high and fast. He is also saying, flying high and fast. Flying high and fast, and then he is also repeating with you like that, and he is enjoying this whole process. So you have taught him different words, the context, without really asking to repeat. He is repeating on his own happily. So these are some of the tips to reduce echolalia, and take my word, echolalia will settle with time. In 90% of the kids it is going to settle very soon. So just enjoy the process of language development in your child and don't get too much stressed about echolalia. And echolalia is never isolatedly to be taken as a sign of autism. So please, if you have any doubts, you can clarify with the professionals. Thank you.